May is National Teen Pregnancy Prevention Month, and across the country, teen pregnancy is at an historic low.
Well, that sounds pretty good, but here in Shelby County, the rate of teen pregnancy is nearly 30% higher than anywhere else in the entire state, and most of those babies are born into extreme poverty.
Yeah, Ashley Coffield is with Planned Parenthood, which is urging teens to consider IUDs or implants. Ashley, good to have you back here on Live at 9 this morning.
Thank you, Alex.
When it comes to teen pregnancy, again, Adam mentioned some of the stats we're seeing. Are we making any progress, and if so, why?
We're making progress. We just still have a lot of work to do here. We're seeing about 2,000 teen births annually in Shelby County, and those are entirely preventable.
Now, we did say there is some improvement. What is the source of that? Why are these numbers getting better?
We think they're getting better because more teens are using long-acting reversible contraceptive. Those are either IUDs or implants. Depending on the device that you choose, they can work anywhere from 3 years to 12 years. Once you get an IUD or an implant, you can pretty much stop thinking about birth control.
Now, we do want to point out really quickly that does help you with pregnancy, but not STDs necessarily, right?
Right. We encourage teens to use condoms as well, and that's where comprehensive sex education is so important, and communication between teens and parents, and having the education to understand what puts you at risk. And at Planned Parenthood, we also have free condoms available to teens and young adults in Shelby County at more than 100 locations.
So, Ashley, at the same time, how do you kind of balance this debate, though? You might have some people who oppose this, saying, well, are you promoting promiscuity, especially among teens, even though this could lead to prevention, but at the same time, are you saying you should become sexually active? What do you say to those?
Well, what we know is that well-designed and well-implemented sex education programs like those that we offer at Planned Parenthood do change sexual risk-taking among teens. They delay sexual activity until they're older, and if they do become sexually active, they use birth control and they use condoms and they have fewer partners. So we really want to emphasize how important sex education is to our teens. And what we also say at Planned Parenthood is that access to health care and access to sex education shouldn't depend on who you are and where you live. That's why the services we provide are so important in Shelby County.
What is the education program like here in Shelby County? I understand there was one for Memphis City Schools, one for Shelby County Schools. They came together, and I think they took Shelby County's education-based program. What are kids learning in school about this?
Shelby County has a good program in place. It's an evidence-based model that they encourage teachers to provide, but we've got a lot of teens in school, a lot of teachers who aren't trained to offer these programs. They feel self-conscious about talking about sex education with teens. They don't get enough training. That's why coming to a place like Planned Parenthood can really help you, help your teens, can help supplement the education that they're getting in Shelby County schools, and can help parents talk to teens, because regardless of what kids get in school, that communication between teens and parents is so important, and it has been shown time and again to delay the onset of sexual activity.
As you were saying, this can be, though, for so many teens and their parents and others, other adults like teachers, an extremely difficult conversation to have, can it not be?
Absolutely. People feel so awkward about it, but what we know is that if parents will just start that conversation, it can really make a big impact on teens' behaviors.
What's a good conversation starter? How should a parent who obviously feels awkward about that, how should they start that conversation?
A great way to start it is to tell your child how awkward you feel. To say, listen, I feel really awkward about this, and I know you do too, but I just want to protect you. I want you to live a healthy, happy life. I want you to have healthy relationships in your life. So can we start talking about this a little bit? And if they don't have questions for you the first time, they may come back later. Tell them your door is always open.
So just be honest.
Be honest. Yes.
Okay. Ashley, thank you very much.
Thank you.
Appreciate you being here.
Thanks, Alex.
Thanks.
Thank you.